Namaste. I'm Alakanandama, Ayurvedic doctor and principal of Alandi Ayurveda Gurukula, a unique apprenticeship style Ayurveda school in beautiful Boulder, Colorado. Hope we may see some of you on the 1st of March, Sunday the 1st of March. We're going to have a really nice open house and hope that some of you may be able to make it there. Now to today's topic. It's an important topic. I'm going to spend a few minutes talking about how to spot the signs of ovarian cancer. So this is obviously important for women, especially women from middle age and beyond. But it's also important for anyone who has a woman in their life or someone assigned female at birth who has ovaries. So it's important basically for all of us to know the warning signs of ovarian cancer, because tucked away as they are in the pelvis with enough space around them, the ovaries can be growing a cancer for quite a while before we find out. Oftentimes we won't find out until too late. I will never forget, as a junior doctor, the side ward for the dying patient, a mother, 33, a mother of several children dying of ovarian cancer. So whatever I say about ovarian cancer awareness, I offer it for her and the too many people like her. So listen to your body. There are a number of very common symptoms that women often have that can be telling us about ovarian cancer. But deep inside, you know, I feel worried about this symptom. And if you get that feeling, this is somehow bothering me or a worrying symptom, then go get it looked into. So the first thing is having a lot of bloating, especially in your lower abdomen, a feeling of fullness or tightness, a bloaty feeling, your clothes feeling tighter, your jeans not doing up properly. You could be losing a little weight and yet your tummy's tighter. There's many causes of bloating, like SIBO, like parasites, other digestive problems. There's a lot of causes of bloating, but this persistent bloating also can be a symptom of ovarian cancer. My own approach would be, let's try treating this, upashaya. If my treatment doesn't work, let's have you see a doctor and look into it a little bit more. And I wouldn't say could be ovarian cancer, but I have that awareness. Also, just getting full up too soon. Just feeling like you can't eat as much as you used to. You can't finish a normal meal. You can't drink as much as you used to. Your appetite is going downhill. And a very important part of that, not only for ovarian cancer, but also for a benign ovarian cyst, is actually getting heartburn. So one of the causes of heartburn is everything getting pushed up because you have something in your lower abdomen, in your pelvic area, that's taking up too much room, which could be an ovarian cancer or a big benign ovarian cyst. I've seen that before with my patients. Urination, having to go pee more frequently than you used to. Having to rush to the toilet, not very much comes out, or you keep feeling like you have to go pee even though there's nothing there, or feeling that your bladder is not getting completely emptied. So again, there are lots of things. Most of the time, if you have frequency of urination, it could be a UTI, nothing to do with ovarian cancer, but just have that awareness if that is a persistent symptom and doesn't go away. Also, some some pain, like a funny feeling. It's not even necessarily a big pain, but a dull ache or a funny pressure feeling, a dragging feeling, pain during sex, pain when going to the toilet, among the many things that could cause this pain. It does include ovarian cancer. You could also be noticing back pain. If you've had your menopause, you could notice some unexpected bleeding. Anytime you get bleeding after menopause, please see a doctor. Losing weight without trying. If you lose weight without trying, you got to see a doctor. It's a red flag symptom. Fatigue, constantly feeling tired, even though you're getting plenty of rest. So those are an important set of symptoms, especially if you have several of them all at once. Like, again, not to be alarmed. These are common symptoms. They can result from a lot of things. However, to have awareness. This is about having awareness, because for so many years we said ovarian cancer is always diagnosed late because it doesn't have any symptoms. It does have symptoms. Listen to your own body. Listen to the woman in your life when she tells you about symptoms that just feel funny or just feel wrong, and get it checked out with your OBGYN, your gynecologist, whatever is the appropriate doctor for your age group. Hope this helps. Take care. I know it's not the most cheerful topic, but we have to think about it. So remember to click the like button, and we'll see you again next week. Namaste.